What we're going to talk about tonight is managing pain by moving beyond pharma. And being mindful of my audience, I'm going to talk about things that are doable in a rescue and shelter setting, which means that you may or may not have a veterinarian or resources available that would be available in a clinical practice. And so I will do my best to frame what can be done in ways that are affordable and accessible, no matter where you happen to be caring for pets who are experiencing pain. So before I begin, I always like to thank my bioethics mentor, Dr. Peter Hellier. Dr. Hellier is an anesthesiologist at Colorado State University, and he's a diplomat of the American College of Veterinary Anesthesia and was a founding president of the IVAPM. I had the pleasure of working with Dr. Hellier over almost 2 decades now. So when I talk about pain or rehabilitation or anesthesia, I always like people who happen to be listening to know that I am a small town veterinarian. So this is the front of my practice. I have 2 practices in this space. I have the Windsor Veterinary Clinic, which is my primary care practice, and I have the Downing Center for Animal Pain Management, which is my pain management referral practice in which I provide full service physical therapy. The reason I like people to know this is that I think it's important for you to know that I don't practice in the ivory tower. Even though I am an affiliate faculty at the veterinary school at Colorado State University, I actually practice for a living. I see real people, real patients every day, and I see non-painful patients as well as painful patients. And I do my best to help my young and healthy patients remain healthy and pain-free for as long as they can be that way throughout their lives. At the Windsor Veterinary Clinic, our practice motto and vision is all about this: celebrating, protecting, and sharing the special love of animals. And in the Downing Center, we're all about this, meaning they, our patients, don't deserve to hurt. And animals that end up in a shelter setting also don't deserve to hurt. I was an English major in my first life, so I like to collect quotes from old dead guys. And this is your first old dead guy quote of the evening. Galen is acknowledged to have been the very first physician, and it's he who said, "Divinum est opus sedare dolorum." And this translates directly from the Latin that divine is the work to subdue pain. So anytime that we can make an intervention in the life of a painful animal, we are doing divine work. Another old dead guy, a philosopher who was a contemporary of René Descartes, said this about animals, that it really isn't about can they reason or can they talk, but can they suffer? And we, of course, know the answer to that question is absolutely yes, they can. One of my very favorite surveys of pet owners was actually conducted a number of years ago, and these numbers have actually increased over time, but I still love this distribution. These were people who were asked to either agree or disagree with this statement. So the statement was, "My pet is a member of my family," and 3/4 of these people 20 years ago said, absolutely yes. My pet is one of the most important things in my life. 2/3 willing to say absolutely yes to that question in response to a statement offered in a survey by a random individual at the other end of the phone. Number 3 is my personal favorite. My pet is a better companion than the other humans in my family. And greater than 50% said absolutely yes. And so what does this mean for us? It means that we have a very precious relationship that we have a privilege to serve. And an example of that relationship is right here. This is my mother. And sitting on her lap is Andre. Now, when I was growing up, my parents didn't beat me and they didn't lock me in the closet. And we always had food on the table and I always had shoes on my feet. But then I met Andre and I found out what my life might have been like. Andre wanted for nothing. And when my mother was diagnosed with stage 3B ovarian cancer and given 6 weeks to live, it was Andre who gave my mother a reason to wake up in the morning. And it was Andre who gave my mother a focus beyond her upcoming CBC or her upcoming chemotherapy. And when my mother died nearly 7 years after her diagnosis, it was Andre who was with her in the hospital hospice on her bed as she made her transition from this world to the next. This is a very precious relationship that we have the honor of serving. And it means that we have job security. And so those of you who are in the business of pairing animals with their forever homes, this is really important work that you're doing, because what you are participating in is care that straddles a lifetime from womb to tomb, from cradle. These puppies were born about 20 minutes before this picture was taken, from cradle to grave. Another old dead guy, a physician from France, generations ago, stated that medicine should be practiced as a form of friendship. And I would just say that friends don't let friends hurt. So we need to do a little bit of background about pain and why it's important and how it works. And back in the bad old days, we had a pretty simple idea of how pain worked. You put your foot, B, into the fire, A, and then that signal went up this train track, C, up into your pain center in your brain. It was all so simple. And now we actually know it isn't quite so simple. So when we in veterinary medicine think about pain, we have to look to human medicine. And in people, the IASP, or International Association for the Study of Pain, is really the organization that provides what is considered the actual fundamental bottom line diagnosis of pain. And the IASP definition of pain is this: an unpleasant and emotional, and that's important, experience associated with actual or potential tissue damage. What I find interesting is that it wasn't until not that long ago that the IASP agreed to expand the definition to include this second sentence, that the inability to communicate in no way negates the possibility that an individual is experiencing pain and is in need of appropriate pain relieving treatment. Now, if you take that sentence away, the inability to communicate could imply that if you can't speak, you must not be able to experience pain. And that leaves out infants and people who are mute, people who have had a devastating stroke and can no longer speak, and of course, animals. And now we know, again, of course, that animals are wired just like we are, which means their pain experience really mirrors our own. So pain in people and in pets is a complex and multifaceted experience. So the components include the sensory informational component. I call this the physiology of pain. Then we have the emotional dimension of pain, and that's the suffering piece. The third piece that we don't think about very often, but it's just as important as the first two, is the cognitive or evaluative component. And what does this mean? This means attention or learning about pain. So for instance, if you've had a previous experience with pain and it didn't go well, the next time that your body experiences pain, you may have a very amplified pain experience. And this is where the perception of threat really comes into play. So why else can we think about pain being important? Well, Albert Schweitzer, a humanitarian and physician, generations ago said that pain is a more terrible lord of mankind than even death. And in fact, many, many people choose to end their lives rather than deal with unmitigated pain and suffering. Oops. And the Buddhists say that pain is inevitable, but it's suffering that's optional. And that's really where we come into play. So it's important to remember that pain is complex. It is scientifically intriguing. It is clinically challenging, particularly in our patients who are not speaking the same language we do, which makes pain easy to overlook, particularly in cats who are masters at masking their pain. And it's worth making changes so that we can improve the treatment of those animals who depend on us, because this is what we want. We want our animals that we interface with to be happy and healthy. So there are consequences if we don't deal with pain appropriately. In the early stages, pain is beneficial. It actually helps us survive, and it may be really just more of a nuisance than anything else. But if we don't manage it early, it can actually lead to a decrease in quality of life. It can become unbearable, and ultimately, with no relenting, with no management, with no treatment, we can end up with pathophysiologic effects, bad physiologic effects. And in fact, pain can kill. It's also important for us to understand that it isn't just about an injury, although pain may start with an injury. If pain is not appropriately managed, it can become chronic. And if it becomes chronic, it's because the spinal cord itself has changed. We used to think of the spinal cord as that train track to carry a signal from the site of the injury to your brain, to your pain center. And it just doesn't work that way anymore. The spinal cord is far more than a relay station. So when we think about pain, we think about good pain and bad pain. And it was the scientist named Clifford Wolf who actually coined the term adaptive pain for pain that's good for us, pain that helps us survive. So nociceptive pain is very transient in nature. It doesn't last very long. Think about this. You put your hand on a hot stove and you know without thinking about it, your body pulls your hand back. Your nervous system says, get your hand off the hot stove or you're going to get burned. That's good pain. Inflammatory pain can be good pain as well, because if you sprain your ankle, your body says, hey, your ankle is sprained and it hurts. And if you don't stop walking on it, it's not going to heal. Here, though, is where we have our gateway from good pain to bad pain, because if we don't deal with inflammatory pain when it's early, we can end up with a spontaneous pain state where there's a hypersensitivity to a pain signal, and we can actually have an abnormal pain response to what should be a completely innocent stimulus. Typically, this is in response to actual tissue damage and inflammation. And if we don't manage the gateway, we move into maladaptive pain. And the first of the two big categories of maladaptive pain is this, neuropathic pain. And many of the older patients, the older pets, older dogs, older cats who've had osteoarthritis for a while, they will have neuropathic pain. They will have bad pain, maladaptive pain. And this is where there may be actually some injury to the nervous system itself, in the case of, for instance, an amputation, or a bulging intervertebral disc. But we can also have damage to nerves from chronic inflammation. And then the fourth sort of big category of pain is functional pain. And functional pain is really hypersensitivity to a painful stimulus that results from abnormal processing in the brain. Here's where we have a little bit of an issue making this diagnosis in animals, cats and dogs, because we don't know yet all the ins and outs of what lights up in the brain when there is pain, because most of the time our patients, when they go into the MR to actually look at the brain, they're asleep. So this will be something that I think is going to unfold in the future. And Dr. Clifford Wolf is the author of this particular paper. What we're really talking about here is a phenomenon we call wind-up. And wind-up is the result of chronic pain that becomes persistent. And this involves a sensitization of the nervous system, both in the periphery, so out here at the ends of the nerves, and also in the central nervous system in the spinal cord, in response to this unmitigated inward barrage of bad, noxious, nociceptive impulses. This can actually result in an animal experiencing pain in a much wider space than the actual tissue damage. And that is really the definition of maladaptive pain, or pain as disease. And it's important to remember that cats are not small dogs, and they do experience pain the same way from a hardwired perspective as dogs and people, but they express their pain much, much differently. And I'm going to actually talk at the end of this presentation about the role that fear and anxiety play in a painful pet. Because this is what we want: happy, happy dogs and cats. So we need to make a pain plan. And even when we're in a situation where we have limited resources, as we do in a shelter setting, a physical examination can and should be done. And if possible, some shelters do have access to low-cost clinics where a metabolic profile can be done. But you have to work within the limits of what your resources are. Once you have a thorough evaluation, then you want to treat whatever is seen, whatever is observed. So if there's an ear infection, you're going to treat the ear infection. And if there's pain, we're going to treat pain. And if we can do some diagnostics and we find out that a dog is low thyroid, perhaps we can find access to thyroid replacement hormone. Bottom line is we want to make a plan for these pets and then work that plan. We now know that when we have a pet who is experiencing a chronic pain phenomenon, we actually need to treat from what's called a multimodal perspective, or a multimodal pain plan. And even in the restricted setting of limited resources in a shelter setting, there are options that can be exercised on behalf of these patients. It does mean multitasking. And if you work with foster families, it means that these people have to be an essential partner for these painful pets, and that these are pets, if they can be placed into foster pre-adoption, it really makes a difference for them. So this is going to be a sort of a subset of your foster families, people who are willing and able to step up and do what needs to be done for these animals. Medication, drugs may not be available. I'm going to talk a little bit about the sort of cornerstone drug that we use, but it's really going to depend on if you have access to a veterinarian and if you in turn have access to medication. But here's something that any organization can deal with. Most chronic pain patients are less active, and that means they're overweight. And that's really common. That's just a thing. And as someone who's been in practice for 35 years, I can assure you that this is the most common non-infectious disease that we see in dogs and cats. And in a shelter setting, this is something that you have control over. So the most important physiotherapy, the most important PT that you can do for these animals is to normalize their body composition or the body condition. I like to talk about body composition because I want to look at both their fat compartment and their muscle compartment. And there's really, really good data out there about the difference between the fat compartment and the lean body mass. And if you actually look at the guidelines, the nutritional guidelines that have been published by the American Animal Hospital Association, you'll find some really good guidance about that. If you have the option in dogs to do some diagnostics, if you do determine that a dog is hypothyroid, it will adversely affect their metabolism if they don't have enough thyroid function. So in a shelter setting, it may be an option to get these dogs on replacement therapy. You can choose a lower calorie density nutrient profile. You can find those in an over-the-counter setting. Both Purina and Health's Pet Nutrition make lower calorie density nutrient profiles that are available as over-the-counter options. But it's going to be critically important to make sure everyone involved with a particular pet is absolutely on track with portioning. So if we turn to any pharmacology at all, if we have access to some pharmacology, if medication can be available because we're partnering with a veterinarian, non-steroidal anti-inflammatory drugs are really the cornerstone. So NSAIDs really give us the opportunity to decrease inflammation and reduce pain. And one of the things that's kind of cool about NSAIDs is they don't just work at the site of inflammation. They actually work at various spots in the nervous system, and that's useful. The other thing is there's no one best NSAID. There's a lot of marketing hype out there about this NSAID's better than that NSAID. There is not one that is a silver bullet. And it's also interesting to note that if an animal can't tolerate one NSAID, it doesn't actually mean that they can't tolerate any NSAID. But in my pain practice, if I get a patient, a dog, who fails one NSAID, it makes them vomit or it gives them diarrhea, and we give a second NSAID from a different class, and the same thing happens, they're done. No more non-steroidals for them. And this is why dogs bite people, but it's one of my favorite pictures. All right. So in a non-clinic setting, in a shelter setting, it's really important for us to think more about breaking the pain cycle from a non-pharmacology standpoint, because these are things that are available over the counter or with the partnership of a veterinarian, but easy access. So we have nutrition and nutraceuticals, and the bottom line is we need to follow the evidence. And use of these options is really going to depend on the resources that are available in your particular facility. If we choose to use omega-3 fatty acids, which we know decrease inflammation, provide joint support, decrease pain, support the immune system, support the skin and hair coat, we know they do all those things. We actually need to use what's called the triglyceride formulation rather than the esterized formulation. So what's interesting about omega-3 fatty acids is it's cheaper to make the esterized form, and that's what most of them are. So if you go to GNC and you pick up a bottle of fish oil capsules, it'll probably be the esterized form because that's cheap to make. But it's the triglyceride form that's actually available to the tissues. Another tool we can use is abbreviated UC2. UC2 stands for undenatured collagen type 2. And this is kind of a unique molecule because in a rat model, for instance, of osteoarthritis, it was actually proven to slow the deterioration of cartilage in the joints. And how it works is really unique. It's a very, very unique mechanism of action. It induces what's called oral tolerance. So you take it orally, and there's a stimulation of the immune system from these little patches of lymphoid tissue in the gut called Peyer's patches. And what that does is it stimulates the immune system to recognize type 2 collagen, which is in cartilage, and it prompts an anti-inflammatory cytokine, and that blocks the joint deterioration that is common in osteoarthritis. And here's where, again, I emphasize we have to follow the evidence, and we have good, significant outcomes documented in addition to rats in humans, dogs, and horses. I will tell you that I also use this compound in cats, and I have found that most cats are very, very willing to take the little treat that it comes in. Another compound we can use is a milk protein from hyperimmunized cows. So the cow's immune system is stimulated, and the milk has these great anti-inflammatory proteins that then are extracted. And what that does is to inhibit this cascade of inflammation that happens in the face of inflammation, like osteoarthritis. So what it does is it blocks then that upregulation of the inflammation. And by doing that, it actually decreases the destruction associated with chronic inflammation. Because this is a different mechanism than the non-steroidals or the steroids, we can actually use it with those compounds. And what we do is actually overlap their use in the beginning, because it takes time for this compound, for any nutraceutical compound, to actually have its peak effects. So we overlap this molecule with other modalities that we use. And once we establish good pain relief, we can adjust some of the other medications. And there really are very few side effects from this particular compound. And the only ones that I've seen are actually related to the gut. They had a few patients that just can't tolerate it. It makes them vomit. So another non-steroidal, another nutraceutical, is a compound, series of compounds found in Perna canaliculus, or the green-lipped mussel. There's certain essential fatty acids like EPA, and a whole palette of bioactive lipids that penetrate into the tissues. And this compound can be complemented by a high hyaluronic acid molecule of a very specific molecular weight. But here's the kicker. It has to be manufactured in a way that does not denature it or interfere with its efficacy. So here's just kind of a gentle reminder. With any nutraceutical, it's about the formulation and not the ingredients. And it has to be evaluated in the target species. All right, pardon me. Okay, because this is what we want, happy patients. So what else can we do that's non-pharmacologic? Well, we could actually take advantage of physiotherapy and physical medicine. Because here's the thing. What I'm going to show you on my screen, these do not require special training, just a bit of guidance. And there are some excellent texts to help you with self-learning. And so what am I talking about? I'm talking about using heat, using cold. I'm talking about using medical massage. There's some really excellent books that any of you can access to learn how to do these techniques. And then TPEMF. I'm going to talk a little bit about that technology right now, because that actually is the technology made available to us by Assisi Animal Health. So what does TPEMF stand for anyway? Well, it stands for targeted, targeted, pulsed electromagnetic field therapy. Please allow me to elaborate. So let's look at the biophysics of this. This is where my nerd brain kicks in. I just love the elegance of this mechanism of action. So what this technology does with this very specific electromagnetic field is increase calcium signaling. And by doing that, it actually modifies the nerve conduction velocity, so it can actually make a difference in pain perception. It decreases the production of nitrous oxide. Nitrous oxide is actually involved in inflammation and pain. And by combining these two things, dealing with calcium and dealing with nitrous oxide, it actually decreases overall inflammation. And one of the interesting things about this technology is that if we have a fracture, for instance, whether it's a non-displaced toe or an animal that's been hit by a car, and you've had the opportunity for a veterinarian to contribute their services to fix that fracture, we can actually speed healing by increasing the number and the activity of the osteoblasts, which are the cells that actually help heal the bone. And so here is an example of a dog who has an injury at the carpus, and we're actually speeding healing by allowing that electromagnetic field therapy to penetrate into the tissues. So what about pain specifically and this pulsed electromagnetic field therapy? Well, it decreases both acute and chronic pain by way of inflammation. It's safe, it's effective, it's non-invasive, and here's what's really important. It actively engages either fosters or forever home providers, because they are able to actually utilize this technology at home. And any people who are involved with pet care, whether it's pet owners, pet fosters, want to participate in that animal's care and appreciate being able to do something positive every single day. There are some really great protocols that are described specifically for various conditions that might cause pain in an animal, cat or dog, and guide the use of this technology so that we can get the maximum benefit. Now, what's interesting is that we also have data that let us understand that slightly different electromagnetic fields can be used both for seizure management and anxiety management. Now, here's where we as medical providers have to use our imagination just a little bit. I mean, inflammation is inflammation is inflammation. So it may not be that we are only going to deal with osteoarthritis, because there are other inflammation-based conditions like bladder inflammation, like pancreatitis and pain in the abdomen, like prostatitis and painful prostatic disease in dogs. Or I've never seen a cat with a prostate problem, but I've seen many dogs with prostatitis. And then wound healing. So here's some data from the human side. In patients who were experiencing protein spilling into their urine, This therapy was able to improve kidney function and to decrease protein spilling into the urine. Reduced pain following breast surgery. So after mastectomy, women can have this loop actually incorporated into their bandages, and it dramatically decreased their use of opiates in the postoperative period. And in a dog model, and here's where the prostatitis thing comes into play. In a dog model for benign prostate hyperplasia, so not prostate cancer in men, this technology was shown to shrink the size of the prostate. And in dogs, this is a published study, post-laminectomy, so intervertebral disc disease dogs. These are dogs that had a spine surgery, their disc material was removed, they had increased pain relief, and they had an increased effect of that pain relief with the longer treatment using the electromagnetic field therapy technology. What's really interesting is we now have the opportunity to treat the whole body. Now, why would that be useful? Well, there are often some dogs and cats that actually have multiple joints involved in their pain and inflammation. In my personal household, just a few months ago, we lost my 24-year-old Siamese. And Miss Muffin had arthritis in her spine, in her elbows, in her hips, in her knees, in her wrists, and in her feet. 24 years old. And she really benefited from literally whole body treatment. And this is not Muffin, but this is an example of a pad built for a cat for whole body treatment. The calming application makes these dogs look like angels because they wear a little vest that holds the field generator in the right location. So some other things for us to think about with the animals, cats or dogs who need help because they're dealing with painful issues and we want to help them from a non-pharmacology perspective are assistive devices. And these are things that really in our local area, we have a couple of shelters that have been able to acquire wheelchairs from pets that have passed away that their owners have donated. We even have a little library of these wheelchairs that have been donated in my pain practice that I can rehome with pets who need them. There are slings and supportive vests. And for those animals who are quadriplegic and really weak enough that they can't walk, it's really not a stretch to talk to people about having a little rolling cart or a wagon that allows that pet to participate in whatever's happening in the human household. This is a patient of mine, Chomo, who began developing rear limb weakness at 12 years of age, and she had to stop running with her owner. And we were able to get her a wheelchair that you can see by the picture that her feet are on the ground. She was using her feet at this point. This was early in her acquiring her wheelchair. Within a week of having her wheelchair, she went back to running 3 miles every other day. And as her weakness progressed, we actually raised the back end of the cart and put slings on her feet to hold her feet up off the ground so she didn't drag her toenails. And when she died, she was almost 16 years of age. She used her wheelchair until the week she passed. And when she died of acute on chronic renal failure. So she didn't even die from her weakness-related disease. Some other things to think about, and this is something that I think we veterinarians, we're kind of slow. We don't think of these things, but we should, is helping either the foster or adopter modify the home environment and home activities, because this is easy. raising the food and water dishes to the elbow height of the pet. Whether the pet is a cat or a Great Dane, it helps keep their back in a neutral position if their food and water dishes are off the floor. We want to talk about covering slippery floor surfaces and modifying access to stairs. I just spoke with a family yesterday. Then we talked this through, and one of the things that they are doing is using baby gates to prevent a painful older dog from having unsupervised access to stairs. And then finally, a ramp for getting into and out of vehicles, because many dogs resent being picked up to go into a vehicle. Another aspect of this is asking the question, what other pets are in the household? So if we have a very old and a very young pet, we actually need to make the humans in the household aware that they may have to modify how those animals interact. So I want to close with a couple of comments about the relationship among pain, fear, and anxiety and stress. So fear, anxiety, and stress, FAS, these are three components that we really need to keep front of mind, because when we encounter unacceptable behaviors for instance, in an animal that's relinquished to a shelter, we always need to think about pain. And we need to remember that anxiety amplifies pain, and pain amplifies anxiety. So it becomes this vicious cycle. So we have to look at the whole patient. We have to look at the whole animal. We have to ask lots of questions, but more importantly, we have to listen. So if we've got foster parents helping these animals be in a more humane, a more interactive setting, then we need to listen for clues and ask for pictures of the home environment. And everybody has a video camera in their pocket. So a video of activities of daily living, so we can really witness what's going on with these animals. Older dogs and cats may be fearful because they're painful. Here's the fact. Animals cannot and do not anticipate or fear their own death, but they certainly can and do anticipate and fear pain. And we have an obligation to prevent pain where we can, to resolve pain when we find it, but we have to first think about it. And that means any pet that we encounter who's reluctant to be handled must have the benefit of our concern that they may be painful. So please, please, please keep an open mind about this. We want to take a considerate approach. You may or may not be aware that there is fear-free training for anyone involved in shelter medicine. And this training is, in my opinion, an obligation for us to undertake. So we need to take a considerate approach and invite that animal to participate in our own care. If we forge ahead, we're going to escalate fear, anxiety, and stress, and we may make pain worse. Bioethics obligates us to consider treating that animal as human physicians treat nonverbal children. And we have to identify those things we absolutely need to do versus those things we just want to do. Because realistically, it's time for us all to be fear-free.